felt some feverish thing. And by the time I got consciousness, I was in Yashoda. నేను ఫ్రీక్వెంట్గా ట్రావెల్ చేస్తాను. రీసెంట్లీ బెంగళూరు అండ్ చెన్నై I traveled. 1 week I was in Bangalore. Then next week I went to Chennai. On my return, I felt some feverish thing. Then I came home, and the next day I consulted a local doctor. He prescribed some medicine. Later on, it was by evening. The fever was cooled. Then next day I felt a lot of tiredness as well as the cough for breathing and everything. Then locally we have gone to a hospital where they have told that there is some lungs this thing is there. Then they all advise us to admit in the hospital. Maybe 2-3 days treatment is required. Later on we can discharge. The first day morning, I know that morning I admitted. Then in the second half I went unconscious, and later on I was not aware of what was happened. And by the time I got consciousness, I was in Yashoda. After getting my conscious first I met Varun sir only. Varun sir came and introduced himself, and he told that he is a consultant for my case. And of course, from the beginning onwards, I was getting a good feedback from him about my disease, and then he has assured that he will get cured within shortly and you can be discharged. And his politeness of telling and briefing about the things, everything was fine. And we also, my entire family is indebted to him for his kindness. Maybe after prolonged period of maybe 16 days, I got my consciousness. Then from that time onwards, another 3-4 days I was at this thing, and I got discharged on 22nd.
Hi, my name is Dr. Varun, consultant pulmonologist at Yashoda Hospital, Hyderabad. Today I'm here to talk about a case which had a new life, or you can call it as a second life. This is a middle-aged old patient who had a travel history to Delhi by flight, and after coming through flight, he has developed a high-grade fever and cough, followed by cough. Later on, he developed a progressive breathlessness, and initially he was admitted at the outside hospital. So I got a call at late night after completing my clinics at Yashoda Hospital, Hyderabad. So I happened to meet the patient, and he was put on NIV ventilator. So after viewing him, the patient was desaturating even on the high levels of PEEPs and FiO2s, and had a multiple session of counseling to the patient attenders as well, that the patient might require ventilator support. So the next day what had happened was the ABG levels were not convincing, and patient had to be put on ventilator, which the patient attenders got convinced with. And they were kind of wanted to go to any extreme to get the patient out of it. So I have suggested them to move to Yashoda Hospital, Hyderabad, where we have all the equipments to deal with the critical ill patients as well. So the patient attenders have agreed to that, and they have shifted the patient next day to Yashoda Hospital, Hyderabad. So I would like to thank the entire AMC team, and as well as the ECMO team, who had as a backup for me as well as the patient. So we had multiple session of phoning for the patient, but in spite of those, the patient's saturations were not convincing and ABGs were not convincing. So we had to take the call for ECMO. In fact, the beauty of early ECMO is to save the patient's life. So we had again a multiple conversation with the patient attendants to convince for the ECMO, which they did, of course. So had to shift the patient from AMC to ECMO ICU. So there we have started the patient on ECMO. Even during this course, we had a lot of troubles, ifs and buts as well, but had to combat, again thanking to the ECMO team as well. So the ACT levels, the flow levels, and in between the fever spiking as well. So they have given permission for us to do a bronchoscopy where we have taken the bronchoalveolar lavage or the ball fluid, and which we have sent to the respiratory film array, and it has detected influenza A positive. So the background of this patient was he didn't know that he had high sugars, that is de novo diabetes. That's the reason the patient had a very bad infection. And when we looked at the HRCT scanning, both the middle lobes and the lower lobes were totally involved in it. So we had to continue the patient on high-end antibiotics, the antivirals as well to the fullest extent, and other essential requirements, and had multidisciplinary team workup to control the sugars as well. So during his course of stay in ECMO ICU, the patient has recovered well, and there was a time where we could wean him off ECMO as well, but continued upon the ventilator support. So from there on, we have to shift the patient to the AMCU or the acute medical care unit, and here we had done a sequential ABGs and tried to wean off the patient from the ventilator support as well. And again, we had multiple sessions of counseling with the patient attenders, explaining about the condition, and the good part is that they stood beside us. From there on, there was we could wean off the patient from the ventilator, get him onto the BiPAP support, which patient has tolerated well. Again, there were lots and ifs and buts again, and patient has developed lot of myopathy, myopathy means patient was unable to walk from the bed, and he had lot of muscle weakness as well. When we examined the diaphragm, the movements were not so convincing. So there was this intensive care support, thanking to the entire team, so which stood beside us and made us to happen this work. And later part of his course, the patient recovered well, and from BiPAP we could wean him onto the oxygen support as well. And as time passed by, we could decannulate the patient in Yashoda hospitals itself, and patient had to walk home without any oxygen support or other requirements as well. So there is this patient again walking into the OP without any oxygen support or any stretchers or any kind of a support, and happily explaining about the course of his recovery. So I would like to thank the entire Yashoda team, ICU teams and ECMO teams as well for this support and giving the second life to this patient. Thank you all.